to be the nurse and the two pharmacists who will be visiting a patient in the home. Do we have the scenario?
These are your objectives, and this is the scenario that we're going to have for today.
So we're going to have 3 sessions here. This is the pre-session, which will be 20 minutes. Each session's 20 minutes long. Then we'll go and do the simulation for 20 minutes, and then we'll debrief for another 20 minutes. So you will have this time for the next 20 minutes or so to get to know one another, set some plans, set some expectations for what you're going to do. And we'll go from there. There's a couple points that we want to cover before you start discussing.
We're just going to go over the fiction contract for how this is going to work. So just so you know, there are medications in the room. They're Practimeds. They're not real medications. However, they're designed to look like real medications. I believe they're still in the sleeve, which normally you wouldn't have, but that's so that you can easily identify them. So what it says on that sleeve they are, that is what they are. Okay. There is an infant mannequin in the room. It's not high fidelity, so it's not going to cry, it's not going to breathe, it's not going to do things you would expect an infant to do, but it is alive. So you don't walk in and think like, oh, the baby's dead and start CPR. It's alive, it's just not high fidelity. If at any time in the simulation you need to call a physician, the pharmacy, or home health agency, anything like that, you can do so. We will answer and take on the role depending who you choose to call. So just say I'm making a phone call and go ahead and make the phone call. If there's anything you feel like you need to step out and there's anything you want to say or talk to each other about that you wouldn't want the patient to hear, you can just come out where we are so we can hear the conversation and the patient won't hear you. So you can feel free to do that as well. As Dr. Wells said, there's no pass-fail with this. The only way you could fail the simulation is if you break your contract and go and tell somebody about this. Then it's academic dishonesty. But other than that, this is meant to be formative, meaning that you're just going to be learning from this, learning to each other's roles, learning to collaborate with each other in a community setting. So the focus is really on the learning, and we're not going to be sitting there with a check sheet. There's no grade involved in this. So just participate. So for the next portion of this, what we'd like you to do is introduce yourselves to each other, your names, kind of talk about the nurse's role in the home and any experiences you have with it, the pharmacy role going into a home, if you have any experience with it, talk about your anxieties about the simulation or going into a real home as a pharmacist or nurse, and explain your roles to each other so that you kind of have an idea. And then you can review the case together and make your plan for what you're going to do when you go in the room.
Oh, I'm coming.
Alright.
Hi, can I help you?
Hi, I'm Heather. I'm from the home care agency.
Oh, yes.
I'm a nurse.
They told me they were sending people over.
Yeah.
Hello, I'm Joffrey. I'm a pharmacist.
Hello, hi.
I'm a pharmacist.
Hi, come on in. Come on into my living room and sit. My back's really bothering me. I have to sit down a little bit here.
Alright.
Seat.
Sure.
You want to sit in your recliner?
Sure, I just make sure my granddaughter's okay.
Alright, so what's going on today?
Well, I'm having a lot of back pain. I've been having it now for several days, and I just knew I couldn't go to physical therapy, so I called and canceled. And the agency was a little concerned that I had canceled this week and then one day last week, because this pain just doesn't seem to be, can't seem to get comfortable.
Okay, alright. And why are you watching your granddaughter today?
Oh, isn't she cute? Well, I'm her babysitter.
Okay.
Yeah, my daughter, she just went back to work. She's a single mother, and we're trying to help her with the costs of things.
Alright.
Because waitresses don't make that much money. You boys available or something? She's a nice girl. So she looked into daycare and babysitting, and it was just too expensive. So I told her I would babysit. I hurt my back like a year ago, and they wanted me to have the laminectomy. I mean, I went through the physical therapy and the pain management, and it just wasn't effective. And when she announced that she was having the baby, I knew it was time so I could help her out.
Alright.
Afterwards, yeah, we're trying to do what we can. She looked into bottle feeding and stuff, but it's so expensive, that formula. So so she's gonna continue breastfeeding, and we even, you know, we use the cloth diapers, we do whatever we can to really, to help us. But she's a good baby, she doesn't sleep, 6 weeks old, she sleeps all the time.
All right. Have you been able to care for her this morning? Have you
Oh.
fed her and
Well, my
made sure
daughter
she
fed her before she brought her over here. She comes about 7 in the morning, so she fed her before she came in. Yeah, that's only 3 hours ago. And my daughter, she'll take lunch at noon. She'll come. I'll have some lunch for her here, and she'll, you know, bring over whatever breast milk she pumped, and she'll feed the baby while she's here. We have a nice little thing worked out, and thank goodness the baby sleeps and she's so well behaved, because that way, you know, I don't have to be picking her up and fussing with her and stuff. So.
All right. So what pain medications did you take this morning?
Oh, my Percocet.
Okay.
Let me get it for you. I kind of brought it down and left it out when I took it this morning. Yeah, I
Sure.
mean, nothing has changed with them. When I came home, they were ordering the Percocet 2 tabs every 6 hours for pain, and I was doing wonderful, but I don't know.
Do you mind if I take a look at that?
No, go right ahead.
Okay.
They just don't seem to be working. They used to send a nice little pretty blue pill, and now they had to change them out, you know, between, I don't know if it was an insurance thing between the generic and the brand or what was going on. But yeah, we had it all worked out. The pharmacy was bringing it off and dropping it off at my house. But you know, my daughter, since I started babysitting, she said she would help me out, and so she now goes and picks it up at the pharmacy. And so they explained to her that I don't know if they ran out or if it was wet. It could be weather related with the bad storms we had, or if it's insurance. So now I have a red and a blue in there, but I don't know. They just don't seem to be as effective. I don't know what's going on.
Okay.